I'm Abby McEwen.
And I am John Randa.
And we're going to talk to you today about the seated flexion test, which is performed to assess the mobility of the sacrum moving on the ilium. Some indications for performing the seated flexion test include any time a physical therapist suspects dysfunction in SI joint mobility. This includes a mechanism of injury such as stepping off a curb wrong or any recent childbirth. A postural assessment that shows asymmetrical habitual postures such as single limb stance or sitting with one leg crossed over the other or carrying a child on one hip. Also, any pain located within the SI joint such as pain over either PSIS or a positive sacral thrust test. Lastly, there could be asymmetry of the ILAs during a palpation exam. Contraindications for performing the seated flexion test include any patient with hip precautions. You don't want to perform the test on a patient who is post-hip surgery and is not allowed to flex their hips past 90 degrees because this could put the patient at risk for posterior hip dislocation. Precaution to keep in mind is any suspected disc protrusion because the flexion activity you're asking them to perform could aggravate or peripheralize any symptoms they're experiencing. The biomechanics of the seated flexion test involve the sacrum moving on the ilium. The ilia are thought to be stabilized when sitting on a hard surface, so the movement should come from the sacrum moving on two fixed innominates. In this way, the test is thought to help differentiate between sacroiliac dysfunction and iliosacral dysfunction. The psychometrics of the seated flexion test, according to Levangi in 1999, include a sensitivity of 9%, a specificity of 93%, and a positive predictive value of 78%. It's also important to note that a cluster of findings is needed in order to rule in or out sacroiliac dysfunction, rather than just the seated flexion test alone. To perform the test, the patient should be seated on the edge of the table with the legs off the table and the feet supported. The therapist is positioned behind the patient. The PT then palpates and places their thumbs directly below the PSISs. The patient is asked to flex forward at the waist, and the PT monitors superior movement of the PSISs. The test is considered negative if the PSISs move an equal distance superiorly. This indicates symmetrical SI joint kinematics. The test is considered positive if one PSIS moves farther superiorly than the other. The side that moves farther indicates a hypomobility of the sacrum on the ilium. The involved ilium catches on the sacrum during sacral nutation and is carried with the sacrum.
And now we will show you how to perform or demonstrate the seated flexion test mimicking a clinical setting. Okay, Abby, today we're going to do what is called the seated flexion test. And what this test helps us do is it helps us determine what type of motion is occurring between your sacrum, which is a bone in your lower buttock region here, and it's located between your two hip bones. So it helps us assess how much motion is occurring between your sacrum and your hip bones. Since you have no complaints of pain or any reason to suspect any dysfunction or movement problems in your SI joints, I would expect to have even symmetrical movement between your hip bones and your sacrum.
Okay.
So on both sides you'll have even movement. Okay, any questions before we start?
No.
Alrighty, so the proper position, so you can just kind of mimic me, is we're going to be sitting at the edge of a hard surface with our feet rested on the ground about shoulder width apart, just sitting up nice and straight. Perfect. And now we'll begin the test. Alright, now that you're in the proper position, we'll actually perform the test. So what I'm going to do is feel for two bony landmarks on your lower back here. They're called your PSIS. And then once I find those, we're going to have you bend forward all the way at the waist slowly, and then we'll have you come back all the way up.
Okay.
Alright, so I'm going to find the landmarks down here. Alrighty, and I'm going to go just in the lower aspect of them. Okay, and then can you go ahead and bend forward all the way at the waist? Perfect, and then come back up. Great. Alright. And now what I saw in that test was it would be a negative test, which means that you had even symmetrical movement between both SI joints. So there's even movement at your hip and sacrum. So we would expect that because, as I was saying before, you didn't have any pain or any reason to suspect any movement dysfunction in that area.
Okay.
All right?
Thank you.
And that is the seated flexion test for sacroiliac mobility.